Hello, my name is Alejandro Venable-Croft, and this is my presentation on Alzheimer's disease and dementia treatment in adult daycare. So Alzheimer's disease is a subset of dementia that affects nearly 6.1 million people in the United States in estimates by the CDC. In 2012, in a similar estimate by the CDC, only 5.2 million people were affected by Alzheimer's disease and dementia, but the Medicare costs topped $200 billion. Now, the effects of Alzheimer's disease aren't just monetary, it also affects people. Now, who has to take care of these patients? More often than not, it ends up being close family friends, and also family. Now, these primary caregivers, on average, can display between 4 and 5 symptoms of depression in correlation with the severity of the Alzheimer's disease and the burden that they had to take on with the disease. Now, I got to witness this firsthand. A close family friend of mine had Alzheimer's disease, and his wife was able to stick with him the entire time. She had the time to donate, that she can be with him all the time. She had the finances to be able to support him, and she also had the support network around her that could also help in taking care of him. However, not everybody has this support network. Not everybody has the type of job that they can take all this time away to help care for this person. Luckily, there are centers that cater to this demographic. Adult daycare facilities, they provide a place that caregivers can drop their loved one off in the morning, pick them up after work, and trust that they're in a good place that entire day. Now, I was going to work at such a facility, the Easter Seals Adult Daycare Facility in Silver Spring. I was going to be working as an activities assistant. I was going to help in the transition between activities, help on their field trips, as well as help in the more administrative side of running the facility, seeing how they get their finances, how they allocate their finances, and how they decide what needs to happen next in the next couple months, next couple weeks in running the facility. So some of my objectives were to just observe the adult daycare facility on its day-to-day operations, see how the staff interacted with patients, see how the patients interacted with each other and with the staff. And in doing that, I was also going to evaluate the concerns about the industry that the caregivers that are dropping their loved ones off, as well as the workers at the facility, have with adult daycare, what they believe could be changed, and with doing that, take what they think, what their concerns are, and see if I can make a plan based on what could feasibly be changed, what couldn't be changed, and seeing how much it would cost to implement these changes. And I would work directly with the director of the facility to see how much it costs for you guys to do this one activity, how much would it cost to do this, have you tried to do this, and then seeing how we can move forward in implementing these changes and developing a price plan for these changes. So my methods for doing this, I was going to provide a QR code or a paper survey at the front desk, and this would serve as an anonymous survey so I can gauge the opinions of the demographic that I was looking for. So the survey, as well as the Google form that was going to be gotten from the QR code, was going to be anonymous so that there wouldn't be any bias in their responses, and I could get a unfiltered, unbiased look into what they think the issues are with adult daycare. And I was also going to work directly with the center's director to see how they can get money, and if they're already maximized how much money they can get, or if there are some untapped avenues that they can go into that they can use to get more finances to help expand their level of quality in treating Alzheimer's disease and dementia in their facility. So unfortunately, around when I was beginning to start my project, the coronavirus made its way to the United States. And as you can see in my graph that I have right here, in age range versus death rates in the United States, the disease disproportionately affects older generations. And because of this, the CDC, the Department of Mental Health, and the Centers for Medicare and Medicaid Services developed guidelines that said that People couldn't come into extended living facilities, extended health facilities, or adult daycare facilities. And because of these guidelines, the Easter Seals, the adult daycare facility, had to halt their volunteer programs, their visitation programs, as well as their field trip programs, where they would take patrons out to different areas around the facility to get them outside and experience new things. So with this, obviously there were some challenges. So predicting or deciding what was going to come next was obviously an issue, because our healthcare system at the moment was very unequipped to deal with this new virus, this new threat. So because of this, we were unable to predict how this virus was going to change, what was going to happen next. So this led to lockdowns, closures, and in all these closures, especially in Montgomery County and PG County, which were the hotspots of Maryland, I was unable to actually talk with my supervisor in person. I was unable to communicate with him effectively, and I was unable to actually witness how the patrons reacted with each other and how the day-to-day operations of the facility were conducted. So if my project would have been able to run its course without any hindrance, there were several public health implications that this could have had. So it could contribute to lowering caregiver depression and stress. So in my plan, I would have tried to figure out a way that we can make it more available for people to get themselves into adult daycare facilities, because it does cost money. And while I wasn't able to talk a lot with my advisor in person, I was able to talk with him with some of the hindrances of the industry. And one of the major ones is that Medicare doesn't cover week-long stints in the facility. He told me that for military coverage, it only covers around 2 to 3 visits a week, and for some people that's just not feasible. They need the 5 days a week, the 7 days a week, because they don't have the means to care for these people. And also in observing how the day-to-day is conducted and what the care providers think is an issue, we could hopefully improve the quality of care that is provided at the center. So that will even further lower the caregiver stress, because they even have a bigger sense that their loved one is in a good place, and that they don't have to worry about what's happening at the facility. And with developing this price plan, hopefully we can develop a framework that is modular enough that it can be adapted to different areas, so that they can change it around depending on what their needs are and what they think is necessary for their given area. And hopefully, if it goes through even more development, it could be spread to different parts of the world that are even more developed, that don't have the means to treat Alzheimer's disease or dementia, because it's going to become an issue worldwide as the population continues to grow. So hopefully this will one day not become an issue, and that people can get the help that they need in helping care for their loved ones, because money should not be an issue with making sure that everyone has the correct amount of care and has quality care. Thank you.